Welcome to Journeyscapes with Ludy as we journey towards self-awareness, self-discovery, self-healing, self-care, and self-love. And as we find meaningful connections towards ourselves, towards others, and towards our source, our God. This is episode 12, and it is about marrying the two great worlds of motherhood, which is really my favorite role in this world, and what we call self-care. Remember, we already did self-care in the past episode, but this time around, this is something new, and this is what we call medical aesthetics. I'm very happy that for today's episode, I have this beautiful doctor with me to share the space on delving into motherhood and medical aesthetics. Pwede ba siya? Pwede! Actually, people would think that, being a mother, dili na ta pwede mag-think about improving ourselves, enhancing ourselves. I was into that also when I was, having my kanang kids growing up. But when I started my inner journey, that's where I found out, no, we should not stop taking care of ourselves. And with that, I know it's going to be another delicious episode this time. We have Dr. Geona Ann Macrohon.
Hello.
Oh, grabe. Dr. Geona Ann Macrohon, welcome to
Hi.
Journeyscapes with Ludy.
Hello, Miss Ludes. Thank you for having me today.
Wow. Gid ko kay pretty kaayo nga doctor. Oo. But before we delve into that, I know excited na kaayo mo no. Unsa may, what does it mean by what we call medical aesthetics? Actually, dili pud kay ko ing ana ka very well versed on that. Although I have an idea, and that's the reason why we have invited Dr. Geona. And again, before we proceed, please allow me to thank our sponsors who have made this episode possible. Of course, we won't be here without them. First and foremost, we have Bagong Pilipinas Visayas Studios, A+ Clinic Premium Aesthetics in Astra Center, TFM Head Spa, the pioneer in Korean head spa, David Salon, Central Block Ayala, Aura Beauty Studio at The Pad, Smile Syndicate Dental Clinic Mactan, V&M Skincare Naturals, Dahlia Chocolates, Pukot Kitchen in El Dorado, Banilad, Atelier Amelie Premium Brownies, Fat Shaolin Frozen Dumplings, Dabi's Ultimate Burger, Iya by the Wata Yoga Studio, Shan's Collection, Migo Expedition of Safari Adventures, and United Neon Advertising. Woo! Thank you, partners and sponsors. And now back to our beautiful guest, Dr. Geona Ann Macrohon. Doc, I'd like to ask, nakadungog manggod ko or I learned manggod nga Macrohon is your maiden name.
Yes.
Oo. And then
I married my husband. The family name is Larino. So I'm...
Larino?
Yes, Larino.
L-E-L-A.
L-A.
L-A, Larino.
Larino.
I'm just curious. Okay ra siya?
He's fine. He's fine.
He's fine.
He's used to it.
He's used to it.
Yeah.
Oo.
So parang
what's the
individual,
reason?
as individuals lang.
Oh,
Because we both come from families we're first generation of doctors. So we didn't come from a lineage of doctors. So we came from non-doctors, non-doctor background. So murag, as a thank you to my parents, I do want to honor them by having the doctor named Dr. Macrohon.
Wow. Nag-goosebumps ko.
So, murag nga na lang. But, of course, my passport, when I'm traveling with the kids, has to be Larino just to avoid the confusion,
Exactly.
you know? So, I have 4 kids and you don't want to have any delays during the immigration and everything like that. So,
4 kids.
certain IDs, PRC, Macrohon.
Macrohon.
But for the passport and for traveling purposes, Larino.
Larino, wow. Thank you, Dr. Larino, for allowing Dr. Macrohon to use her maiden name. You mentioned about 4 children.
Yeah.
Wow. Actually, I also have 4 children.
That's nice.
What are the ages?
So my eldest is turning 6 this August. So I had her during the pandemic 2020.
So, kagmay pa.
Yes.
Wow.
3 of them are in their toddler age pa. So very gubot pa mong balay. So the second one is turning 4 this May 22. The third one is turning 3 May 8. So less than a year apart ning duha. So I have
Wow.
Irish twins. And then the youngest one is 1 year and 7 months. He's turning 2 this September.
Wow.
So sunod ang second to fourth is 2022, 2023, and 2024.
Oh my God.
So
Imagine that. You have 4 kids and
Yeah.
yet you look fabulous.
yes, I guess part of it, you have to look good to be able to perform well your motherhood duties, diba?
Oh my God. Now I'm getting excited. Super excited because I wanted to know. Ako ni siyang i-grill gyud og maayo later because I'm actually very interested in this topic. One, because of motherhood. Again, I mentioned a while ago, if there's one role in this whole world that I so love, and it is motherhood. I know that it's not a smooth sailing out there, being a mother.
Yes.
But I still believe that, it's the best gift given to me. I'm just so grateful, deeply grateful for having children.
Yeah.
But that's the thing. It's also quite challenging. Like,
Yes.
having 4 kids and especially with the job that you have. Okay,
Yes.
later on, ato na siyang i-dig deeper, no? I cannot just imagine, you have to make sure that you look good because you are a walking advertisement
Yes.
of what you do, being a medical aesthetic doctor,
Yeah.
right? Oh.
So I guess motherhood in general has the picture of motherhood has changed for the past few decades since the women in our generation for the past pila ka decades have chosen a role outside of the home, right? Outside of being just a homemaker, but apparently stepping into professional roles. So mothering in the 20s or after or getting into jobs or getting into your professional lives is different compared to how we were raised looking at our mothers
True.
who were at home cooking meals. Sila jud sinina na to hatod ko sa school. It's different in
So
the
how-
generation now.
I cannot just imagine. Balik-balik yun ko. How does a day look like to you, Doc?
So it starts off slow because well I'm fortunate enough to have a lot of help. So I was this is something also more
Yeah.
kumbaga, what my friends see like as a skill to have kept my house running smoothly.
True.
You can do that if you have a lot of help. So of course, thanks to my parents and in-laws who are willing to cover for us whenever we're
Yeah,
traveling.
true.
And also our household help. So with 4 kids, imagine.
True. How
Can
many
you guess
household-
how many household help I have?
Probably-
It's not something to brag, but it's
Yeah.
actually a lot to
Yeah,
maintain.
how
Okay,
many?
you guess.
8?
Yes, I have 8. I have 8. So 4 yayas, 1 per child. I have 1 who takes care of the kitchen, the parang senior. And then 1 who takes care of the laundry because you can imagine how many basket of laundries she has to take care of in a day because having 4 kids, it changes probably
Yeah.
every hour. And then I have 1 who is parang assistant pull out for the clinic, who maintains the clinic. Then we have 1 driver who stay out.
God.
Mona siya, the 8.
You're so blessed. You're able to afford those. I mean,
Yes. We wouldn't. We would say that we are blessed that we are able to afford, but without them, we wouldn't
Exactly.
be able to work to
Yes.
be able to provide the life for
I
them. Because
totally
if
agree.
you're at home, you're not earning, di ba?
Yeah, oo.
Okay, you are sustaining
Yes.
or running
yes.
the home. but you cannot do business.
I'm so blessed also that I have, the reliable household helps
Yes, that's
when my kids were growing up. So the most yayas that I had was three in
three.
a small house because we used to live in a smaller house. The house that you purchased when you were still planning to
Working.
get married.
Yeah,
Because that we did that with my ex-husband. So we bought a house even if we were not yet married. So it was smaller, and then so we grew our family there. And I could imagine there were three house helps to help us. And then I told my yaya and even my friends, I told them, if there's one thing that I would like to have a holiday, like di ba naaman tayo, araw ng kagitingan and so on and so forth, I'd like to have a day to celebrate for the household helps because without them, I tell you, what you did, you.
So you mentioned you had three, but the gaps for your kids is how many years?
I had two, and then I 1 and 9 months, and then four. The youngest is 4.
Years. So
So yeah,
a little bit spaced out
yes,
more. So mine
it's
is
1 year.
yeah, it's I think for me I wanted the yayas to be more focused on one.
Yeah.
Because now the challenge when you're starting a family is it's so hard to find a yaya. Although you can do it abroad man, but why here sa Philippines it's so hard? Maybe because of our working hours, it's not as family friendly. So for me and my husband agreed na one yaya per child.
But that's actually the ideal.
Ideal.
But
Okay,
not everyone can afford one
yes,
yaya per
actually. So
child.
that's why ang amo because diba we're doctors, so we have a lot of classmates who are also starting their own family and so we would always say if you have the budget, if you have a
Yeah.
yaya, you can work or double time ang good to earn, to
That's right.
support your household at the same time to sustain the salary for the yaya.
True.
So
The things that you can delegate, then delegate.
then delegate
But it doesn't mean that,
that you are less of a mother
yes, less
because
of a mother.
you
Yes, I
delegated some of the tasks. Because again, parenthood or motherhood is very the picture of motherhood is very different. Like for example, my mom would always say, "Oh, why when you were growing up, I was so hands-on.
True.
I know how to braid your hair, na lotion pa, medyas, kanang you were so neat, kanang your dad drives you to school early in the morning and then fetches you pa jud. Why can't you do it?" Of course, my mom guilt ta kay nganong
Oh,
laoy, ano. But I came to realize that the working hours for me, because I start my clinics at 9, if I drove them pa, and then sometimes I don't have a cap manggod on what time I stop. So I can go up until 9 p.m., 10 p.m. But then when I go home, tired. You know, as human as we are, we also get tired,
Yeah.
and we do want time for ourselves. So
Yeah.
you know, you just want to stay because you are so overly stimulated the whole day. Because what you do for work, you have to explain a lot to probably at least 5 individuals per day who take their time, at least 30 minutes panimustoryaan before they could fully understand, and you don't want to rush things. So the bulk of your day during work is like interaction, right? So sometimes you just want to hide in the corner when you get home and then no interaction. But when you get home, especially if awake pa sila and I have 4 kids, it's so noisy, toys are everywhere, they're fighting. Ano bitaw murag, pwede mo tago lang sa cabinet and then pwede mag cellphone, you know?
But
Just to
have
pass
you
time.
noticed that there's somehow between the mother and the father, there's a different energy also on
Yes.
on how they carry out their role as a mother and as a father. I think mas ngilngi moingon jud ko di. I mean not to in that part mas believe ko. I remember I was not yet driving before and I had to go to the mall to do some errands. And I asked my ex-husband na can you take care of the kids, and then bring them to the mall because I'll just meet you there. And then, no. So, 3 kids pa to niya, no, I cannot. And he was driving na, no, I cannot do that ko. What will I do? So I decided, okay, sige, I'll just take the V-Hire. I'll be the one to take the kids. I took the V-Hire. Guess what? I took the VR. I took the 3 kids with me. And then I had 1 boy na during that time. And then we went to the mall. I did a lot of things. I went to grocery. I went to buy shoes and, pero grabe, nagay party ito nga, gukod yun. Nga, ay, Rafael, where yun niya? Uy, Lutz, ang imong anak ni Dagan. I mean, yun niya, yung makamit pa ka og mga clients and friends. So, grabe yun to. Pero dito ko nakaingon nga, lahi gyud ang atong energy. Men can easily give up, kita lahi gyud.
I would disagree. I'm the one who gives up.
So, wow.
Yes, because
So between the two of you,
my husband is more.
What kind of doctor he is?
He's a cosmetic surgeon, so it's somewhat of the same field. We do have the same hours, but siya, maybe because of his demeanor. My kids are so used to me, sige lag, kanang yaw-yawan ba? Because I'm the type. I'm the type who says a lot of things and then to the point that they're not so as scared of me
anymore. I
because
think it's like that.
They're used to me talking a lot, dagan kay comments, whatever. But then their dad says so little, pero hadlok dayon sila. But my husband likes spending time with them. Like last week, I was running late from the clinic. I was ending late, and he apparently ended early sa iyang work. So, he had time for the kids. He went to the mall with the 3. Kaya di pa man kaya ang youngest nga walay yaya. So, the youngest of the 3 was turning 3 naman. So, na nagibuot. Ano na ba? So, he brought the 3 to the mall. Nag-J-mall sila. No yaya. Everyone was on their seatbelt, seated during the car ride. Nobody was kanang mag-get-get ba?
Very
behave. He was walking through the mall, no need to hold hands. Maybe because I'm a bit anxious, I need to hold their hands. So murag mas matense sila na ako. But my husband is a bit more calm and good. So
wow.
He lets them mudagan, balik na siya. So he's more of that type. Like when we go grocery, I'm always like, asa si Gion, asa si Grayson, asa si... I'm always like that because I have this, the fear at the back of your mind. Kay Mayana, basin dagit na to or something like that. But my husband is more calm, so mas mo trust siya nga nanay buot ang kids ba. So he gives them a bit of freedom. But of course, mahadlok mo po ang bata sa iya. So we're good cop, bad cop. But then when he's angry, hadlok gyud ang kids niya.
Oh,
so different.
If you have 4 kids, they make fun of me. My kids make fun of me because when I call them, maharos na kong tanan before actually the intended
person.
Child. So Daniel, Gabriel, Rafael, Micaela niya. Daniel, ay si Micaela, so mahurot na kong sulti pa. Daniel, Gabriel, Rafael, Micaela. Then they would laugh at me kay ang akong intention was only to call Micaela, but Mimi, you could no longer memorize all our names in that case. So that's the thing about having a lot of children and getting old and murag na tingali ni koan ako memory loss.
They say ganit daw nga I know with my kids I get confused man sad panagsa, especially because they're all named letter G. So Georgina, Grayson, Gian, and Gavin. So the 2 boys katong sunod kayo sometimes Gian, Grayson, ma-interchange ito ng But it's probably part of the chaos bitaw.
Yeah. So it's chaotic, but the thing is sometimes I thought of it, yes, I have chaotic. I used to think of yes, my house is quite chaotic, but it simply means or signifies that There are people living there, and
Yes.
we are, probably having a good time together. I mean,
Yeah.
kay kuan man siya, gubot man siya. So kung dili gubot, meaning walay
Walay
tao.
tao.
Oo. So mao na lang nang atong
Yeah,
akong
because sometimes, like, for example, me and my husband, we try to make it a point that we do travel together nga wala kayo kids, or we try to spend time with each other
Yeah,
alone.
true.
So, sometimes when we try to do that, we end up missing the kids' food. Like, when we go there and we see something nice to do with the kids, mga na mingaw manon ko nila. So, murag, mga nagyapon kag, bitbiton po nimo sila tanan. Gubot kayo, you
Gubot.
end up being sapot. Mo
Ay,
go home early.
sus
Imbes
na.
mo ni amo imong plans the whole entire day, nagisapot naman ka. So, we end up staying at home, bored, ana. So, it's like, true, the chaos, and then you have to give time for each other pod. But then before, because we're only two siblings man, me and my brother. So, when I got married, I really wanted to have a big family. So, mo jud na ako ang
Wow.
dream na daghang siblings.
And you
Because
got it.
when I got married and then my brother went to Australia, I saw how my parents were alone ba. Paspas kay na empty nesters. So, I wanted to have more kids nga napay mabilin, Napay napay mabilin with the parents. And ko nga, okay, magdaghan kog kids. But, as a doctor, you can't marry early man kay dugay pa man ang start of the career. So,
True.
I got married 29.
Ay, that's why. Okay. But
So,
no, I got married at 28. So
I got married 29.
it's not too late.
Thankfully, na buntis dayon ko after the wedding. So, nanganak dayon ko the following year. So, at 30, so I told my husband, sige, because I want a big family, if normal lang akong delivery, I would want more kids up until I'm 35. Because when you are beyond 35, it increases the risks, man. The maternal risks during pregnancy. I don't want to be, kind of fighting for my life just to give life. So, anak ko, so any number I could do before I turn 35, and then 35 we stop. And then that's the time we enjoy as a couple, and then we child rearing year. So, which is something we did.
So, kuan yun siya. Well planned.
Well planned, and thankfully God permitted, di ba? Murag gi-bless
We're
with.
so blessed.
Yes.
Oo.
So, we did that, and then we ended up with 4. When I turned 35, we decided nga, lami man daghan kids good kay even if gubot, if I was blessed enough to give birth naturally to all 4. So, if ever lang pud we might change our minds by the time we're 40, because apparently everybody's giving birth late naman. So, from the 35 age mark, murag na-extend na siya up to 40, pwede ra. Murag, okay pa, madadapag until 40 mag-pregnant. So, my OB nagsabot me. Doc, what if ganahan pa ko mag-baby, 40? Siya, sige, mag-IUD lang sa ka.
Really?
Contraception. So, IUD. And then, apparently, there's very rare case, my IUD migrated. And they had to open me up surgically to remove the IUD. And then, apparently po, in studies daw, or according to my OB, if you're a migrator or that happens to you, there's always that risk nga if we reinsert it, it can happen again. So that gives me or puts me at a risk to do the surgery again to remove. So anak ko nga, what if every year siya mag-migrate? So every year ko nila i-open. And ko imbes akong gipaningkamutan nga man normal, 'di ba? Para dili ka ma-cesarean. And then i-open na noon ko surgically. So anak ko nga, if they open me up, pwede i-ligate na lang ko kay I'm happy naman sad with the 4 kids. Okay, I think 4 is enough for me to populate the world. Diba?
It's enough.
There's a lot.
But
my
you have,
age nga wala pa eh.
sorry, you have, a boy?
Yeah, we
Yeah,
have
so
1 girl
complete
and
na.
3 boys. So, ko nga. Then we thought about it. Maybe 4 kids is enough. Nasad siguro, no? Ang uban gani, naglisod pa for 1. I think it's enough. And then, we talked, me and my husband, we talked nga kanang, how much time are we spending with the kids? Kay kanang, with our busy schedules, if we have more kids, we are more spread out, less time to spend individually. Because my husband likes to For example, if he's not busy today, yan ay take out ang katong second child na sad, and then
True,
the next available schedule, yan na po na i-take out ang third. Kanang without the
Oh,
yaya,
yeah.
murag iwan-anuan niya
Yeah.
ang boys or ang kaning daughter na mo, ana. Kanang nanay buot.
Oo. Actually, I used to do that kanang, we call it kanang date time. So, take turns na ako. I took turns sa mga kids. Oo. So, sige, kita na sad karon mag-date, niya, ana. So, I used to do that, and it was very nice because that was the time nga, mura mo magka one-on-one.
Yeah, and then you
murag-
discover the personalities.
Yeah,
Bitaw na
oo.
even at 3 years old or at 2, nana de
Hindot
personality
kaayo.
mo ang child that's different from the siblings. Kaya you automatically assume ang good nga all these 4 kids, wa pa ni buot.
Bitaw.
Pero karon the kids have so much
Wow.
so much sense.
I tell you.
Yeah, so
As in, my kids are I've been telling this to my, in my blogs and all, that my kids are my teachers. They've taught a lot
Yeah.
of things, no? Kuan gid sila, they can be very wise, they can be very sensible. We cannot underestimate
yeah.
them. Grabe na gyud. So, very sensible kayo. So, yes, I agree on that. Believe ko sa imong husband, no, he's very hands-on when it comes to rearing the children.
He's not hands-on, like for example, kanang changing the diapers kay Ludanon man siya.
Oo.
So,
But
the
really,
typical guy ba nga kanang di siya kanang mag-ilo. But in the child rearing, I appreciate that he likes to spend time gyud nga kanang
that's really
one-on-one.
very
More
nice.
gana mo sa dihang work specialty. Ako mo kuy patience to like go out to the, of course, kay kanang, for example, you go to the mall. Ako, I'm rarely going to the mall for my personal, personal nga tuyo. I'm usually in the mall for grocery lang. So, every time I go to the mall for personal things, I try to make it time for myself. Mura bitong selfish time for myself. So, I don't wanna be bringing kids with me
Ano
nga.
siya?
Magdagandagan ko dito.
Yeah.
Nga, mag-try patag-fit. Sinina.
Nauna siya tawag og me time.
But
Oo.
more, I feel like if I wanna go there, I wanna spend at least an hour for myself. Dili ingog ka nang have to be watching the kids. More selfish. But, I don't know. It's something you want to keep something for yourself without wood. I don't know if that goes through.
it's because in motherhood mo lagi na, it doesn't necessarily mean that you're a mother. You could no longer do what
You used to enjoy.
Like, yes. So you can actually do a me time. Wala
Yeah.
problema na. And kana uso na kayo na siya karon.
Because I feel like if you feel good about yourself, you can be a good more the way you mother your kids more ano ba, your performance is better if you feel good.
There's a rising awareness or increasing awareness on self-love. And that's one of the reasons why I really advocate on, getting into self-awareness, the inner journey. Because a lot of what we know before are no longer, they are outdated this time around. Like, the overgiving to children ba? Kana bang giving out of love. So for the sake of mo give out yun ta sa atong kanang love, no? Kay because they are our children. But little did we know that actually before we can even give love out of ourselves, we have to fill in our cup. So we have to fill in what we call kana laging gitawag nato og self-love. And when we say self-love, diha mo magkatay naman na siya si self-love, si self-care. Magkatay na sila. So igagaw na sila. And that is why it's very important sa ako nga we try to advocate also on self-care. And self-care man good is very broad. Daghan na siya og poda nato nga kahisgutan, no? And sometimes they think of self-care into lang siya, wellness. Oo, but
Vanity.
Vanity. But actually daghan kaayo siya, no?
Yes.
Daghan kaayo siya og kanang branches or daghan gyud siyang murag sub And today, ang atong hisgutan actually, try na to og marry and make sense kung as a mother ba, applicable pa ba sa iya ang gitawag nato nga pa-beauty or aesthetic. And in your case, medical aesthetic, it's not just, you mentioned a while ago, katong wala pa nag-start atong ano, no, nga aesthetic is generally known for pa-kilay,
Facial,
pa-facial
mga
and all, oo. But what you are expert on is the medical aesthetic side.
yes, more
Oo.
of the
So,
injectables.
okay, so can you expound on that?
So, medical aesthetics is more of the medical side or understanding how your anatomy works as we age. Not just being a mother, because medical aesthetics applies to both sexes or genders, or all genders who want to look good externally, as well as now there's an emerging science for regenerative medicine, man. So not just looking good but feeling good, and not just anti-aging but well-aging.
Wow!
Yeah.
Not just anti-aging but
Kasi, di ba, before we
well-aging.
always say
Yes,
anti-aging,
yes, yes.
anti-aging. Why would you fear aging if you don't look your age or you don't feel like you're old?
Oh.
Diba? Now the trend is, manghambog na ta, I'm 60 but you don't look 60.
Oh, I have that kind of feeling.
Yeah.
I'm 54.
Diba? So, murag, the goal there is not to stop aging because time is our enemy, diba? Every year, mag-birthday man gyud ta. Every day, 24 hours per day. That's fixed. But how you age or how you cope up with the running time is something that we can do something about. So, my husband would always say he's keen into, like, when you have this dilemma, you handle things first that's tangible, that's something you can control. So that is the case of medical aesthetics. So, or again, with well-aging, okay, you can never stop your age, man.
So
But you can look
well-aging.
good
You can still look good.
despite the age.
Oh, I'm very hopeful that at age 60, I will still look good.
Yes. So, the trend
Medical
now,
aesthetics.
the trend now is people starting a little bit earlier. It's not just reserved for the later age groups. Why? Because, again, it's not anti-aging anymore.
Oh,
So we want to preserve
I really
how you
love
look
it.
like
Well-aging.
during the earlier years, and have you look like that for the next decade. Okay? It's not totally reversing or changing how you look like, but you want to age gracefully and as much decades before that actual age, bitaw.
And what is the rationale behind it? Because looking good will make you feel
Feel good.
good, and feeling good will make you
Perform better.
perform better.
Yeah.
Oh, yeah.
So I always remember when I went into, because after med school you apply for postgraduate internship. I went to Manila, and then they asked me nga kaning, why do you want to be here? Because apparently that hospital that I applied to had the dermatology training that I wanted. But I changed my mind and I decided to go here for Cebu. I said I wanted to take my chances in case I wanted to go into dermatology. So, why dermatology? Because I feel like when you have good skin, everybody treats you differently. So that, in the sense, when I was applying, I was younger then. I was just thinking about, acne, pimple, or you have mga skin disease. But later on, when I became a doctor, I discovered that it's not just restricted on the skin diseases per se. There is a rising field of medicine, which is medical aesthetics, which was something I was more interested in. So it's not just reserved for skin alone. It's more of holistic approach.
Holistic approach, but Doc,
Because that was the up and coming trend at that time.
I think I'm I'm leaning on the how do you call that? I would say I'm leaning on the kanang tawag nila og
Conservative.
simple and maybe conservative or like simple in the sense na I don't really wear makeup and
Yes.
my daughter gave me parang lip shiner and that's what I usually put on emergency but not every day. Murag emergency like having a talk show nga na ba. And then in fact iya pa kung gikuanan og kanang blush on but then I don't really use it. Pang super emergency na gyud tingali to anyway. Because I think for one I had fears. And with ignorance, you get into fears that you don't, things that you don't really know. So I had a fear of maybe tingalig makaano siya. Naa siya
Makadaot.
side effects. If you, like for example, kanang gitawag na tog invasive, oo. So kung invasive siya, tingig na side effects, it will affect my health na noon, mga na. So tell us how true is that?
So, knowing the products that you're putting in your face or in your body helps a lot to explain that this wouldn't happen to you, Mariana. And understanding how the product works is essential. Like, for example, most of the time, or for example, first time visits for most patients, especially kind of mga older na less techy or less exposure and stuff. And then when you try to convince them, oh, you have a few lines there. We can,
Ouch!
You have,
Doc. Oo.
you have a few lines there. We can try to do Botox. And siya, di ko anang Botox to kay magbukol-bukol or malain akong nang or dili na muliho. Then I show them my face. I would tell them, would you believe that I started my Botox journey when I was 26, turning 27? Wow. And that would say I would have had Botox for the past 9 years. And could you tell me if my face is the one you're imagining? Nagbukol-bukol or wala na nilihok? Hindi siya bitaw, Doc, no? Wala man di ay. Now, that is something that one should understand because Botox does not add volume or does not add bukol-bukol. It only stops the movement of the muscle that causes the lines in the face. So, the static lines is what we call the lines that appear even without smiling or grinning. So, kung naana na nga lines, it's something semi-permanent. So when you,
So,
that's
ingani na
because
gyud akong now.
that's how you animate or ingana ka mulihok sa imong face. So the skin keeps folding, and the one that's moving the
Magana lang.
skin is the muscle underneath. So you put Botox on the muscle, it paralyzes that muscle, or it stops the movement temporarily, enough time for the skin to not fold.
Wow.
So you don't produce that line for the next 4 to 6 months. So the skin can unfold and then give you less of that line. If you're more consistent or you do it at an earlier stage where you don't have the permanent line, kung at rest walay line, it only comes out during movement. If you do it at that phase or at that stage, nga, mugawas siya during movement, it allows time for the skin fold to not form. So if you're more consistent, maybe after 10 years, the line has never formed, then you would probably not have a line on that area. Good.
Wow.
So that is something that happened to me. Because I used to have very poor eyesight. So that's usually when we see a lot of lines around the eyes. Kaya mag-squint man a lot. So when I had Botox consistently, I didn't end up having the lines.
Wow.
But I can still move my face.
Oh,
Diba? So
true.
it's still mobile. So the ano-ana is more of knowing how to dose your patients, choosing the right product, and going to a good injector. Not just me. There's a lot of injectors. And knowing how to relay what you want so that you don't end up with something that you do not like. Doc, gamay lang ha. Ana, or I still want to move my face. I just want a
So
little
you
bit
can
of
do that
elevation.
pala.
It's customizable, man good.
Hala
Muna,
ka funny,
exactly. Customizable
customizable.
according to what you like and according to your budget. Okay,
Wow.
of course, medical aesthetics is mahal man. So budget is required. So murag,
That's why it's a multi-billion-dollar business in the whole
yeah, because
world.
everybody again
Yeah.
wants to look
Yes.
younger as well as wants to look
Oh
good.
my God.
Especially now with the social
Ako
media.
mga anak murag nasayop gyud og kuan ay kuha sa ilang kurso eh. Joke.
Actually, no.
I'm just
Yeah.
kidding. I'm just kidding.
We always say in med school, if you want to be really rich, don't go into med school. Okay, people are thinking if you were a doctor, you'd be rich.
Uh-huh.
It's actually not the case.
Oh.
So, kaning karon ng day and age, mga social media something, it's actually more lucrative. If I was able to turn back time, I would have become
Really?
an engineer, a dentist.
Really?
No. Dentist is very nice.
Oh.
So, veterinarian. It's very nice. Kana engineer. Sa pa man. Kana social media marketing and everything. But I guess dili ni nako talent.
Ang ano, so actually mauna siya. We have our own kwan. We don't need to compare ourselves with others. Mao gyud na siya because I believe we have our own design. We have our own purpose. You have our own
Path, no?
Oo, career path. But I'm just kidding anang ko. But you know sometimes it comes into our mind nga lano ing ani no because I've read a lot na how. So if this has become a multi-billion dollar kind of business, it simply means that there is really an increasing awareness of the increasing need and demand.
Yeah.
And you mentioned a while ago because people want to look good. Because when they look good, they feel good. And if they feel good, they perform better. Diba?
Like they close more deals. They are able to sell more in terms of presenting themselves better during actual meetings.
So
They're
what
more
are
confident.
what do you think are the myths?
The myths is more of
Aside
like,
from what I mentioned kay ako personally mao man to ako kay akong feeling ala tingalig mo affect siya sa akong health maunsa na inuon ko. I mean but of course I didn't know anything about it. I just read some articles and
so of course it's not just myths, Manggod, because there are a lot of illegal practice of medicine now, like non-doctors injecting fillers and ending up with botched appearances man. So that's what generally dictates the fear, Manggod, for some who see the effect of those illegal injections. And then that casts a shadow towards the legitimate injectors. Kay Morg, kato siya na ing ani man iyang face, dadili lang kung na to. So, it's more of how we educate lang the patients that we're not using the same material or we are doing it safely. That's more of the recourse to the problem. But going back to the myths, like for example, you won't look natural, your face won't move anymore.
I think that's me also. I don't want not to look natural.
Like yourself.
Yeah.
You don't want to look different.
Yeah.
So, yesterday we had an event, Manggod, of about 30 people. We launched this very popular skin booster from Korea. And then I'm one of their KOLs here in Vismin. So, I was talking about them. So, gone were the days where, the Barbie forehead was the trend, the overfilled syndrome, nga, puffy, you end up puffy looking. And then, the faces nilang Madonna before, nga katong more na botched. And then the Kylie Jenner nga nado si fillers here and everything like that. So, that was the... for the past 2 years, the demand for fillers really dropped, like suddenly, because of the what's this? There's a lot of social media backlash in terms of overfilling, like injectors doing too much and in one sitting, and then you don't know the long-term effects of that overfilling. So that's why it's very important to go to a legitimate
injector.
Somebody who is well trained and in using that product, as well as somebody who would not overly inject you. Because, for example, what's pretty to her might not be pretty for the next person. So you have to, my best advice for any patient who's looking towards getting medical aesthetic treatments is you have to jive with the one who's doing your injectables, because you both have to understand your goal. Because you have to go back and forth, man. It's not just a one-time thing. It's not.
So it's like a partnership.
Yeah, it's like
really
a partnership.
choosing the right partner.
Yes, and then it's not like, for example, when you're doing fillers or you're doing Botox at one area, it's not gonna be the solution to all your problems. So combination treatments is still something that we do promote.
Okay.
And then choosing the right products when combining treatments is very essential, because you don't want one product to react with another product.
Wow.
Even if the product is good. And then you need to know when to use it, space it out, and to avoid any possible complications or reactions.
So there is now I'm getting this idea. It's not as simple as
Yes,
inject
injecting.
and
Yeah, you have to understand how
There's-
like, for example, the anatomy. Sometimes one brow is lower than the other, so you might have to dose the other one a certain way to try to balance it out. You have to do one side a little bit more, and then when we're doing facial balancing procedures, you might have to do more on one side. Okay.
so complicated yun.
So, yeah, okay, for example,
complex.
Me as the injector, I find this side, the left side of your face, pretty, but for the patient, di siya ganana to.
Hala, no.
So that is the dilemma. You have to discuss and you have to educate patients. Why this is the ideal part? Why this is the, did you have a dental procedure before when you were younger, when you had braces? That's why you have a bit of a thinner side here. You had bone resorption on one side. Why are you more lopsided on the other side? Are you a side sleeper? Are you, you have to discuss. Okay, only then would they realize nga, they know, always when they ko mag-chew on this side, that's why this side is more prominent. I have a bigger muscle here. Naibtan man day ko third molars on this side. Apparently, out of the 4 molars, I just had them all here, the 2. And then I had them removed. So katong pag-braces nga time. Because, diba, before, the trend was, ibtunda yun. Probably when I was in my early teens. The trend was, when you get braces, ibtun tanan third molars. But now, if you see dental videos, they try to preserve the teeth, whatever. They're not too aggressive in pulling out the teeth.
Do you know
Diba?
that
That's
they
trend
had
now.
to, the dentist had to pull out only one on all my teeth were healthy. But because it was too crowded and my teeth were too big for my frame, so she had to take out two from my upper teeth and then 2 from the lower. But do you know that on my left, she took out, instead of 1, she took out 2. And that's why my teeth now, mura na siya, ni-move na
Space.
siya. Imagine that.
Yeah, and then usually the side where you took out more tooth, that's the more lopsided side, because you lose the bone structure there.
Hala eh.
So it matters, the history.
Mas stress man sad ko
It's
magulaw.
different mangod kay, like, for example, ever changing ang trends. So
Yes.
maybe decades ago the trend was ibot. But now the trend is save the teeth, save the teeth.
For me, that
You conserve
should be
your teeth. Like, for example, before, the veneers was shark teeth. Di ba? Katong gamay na lang kay ang teeth mo bilin. But now it's like front lang, panipisay lang kuhaon to try to conserve the teeth, lesser lang. So
nag-evolve gid siya, actually.
ever evolving manggod.
Ever evolving
So,
gid siya.
we cannot blame the dentist decades before, because that
that's
was
that's what they also learned.
and
That's
that
what
was
they also knew.
the good
The
thing to
best,
do, the best
the
option
best.
for them at that
Yes,
time.
during that time.
During that time, given
So,
the technology and the studies and everything.
so lucky kaayo ang
Newer
mga
generation
newer
now.
generation because technology
Ever
it keeps
evolving,
on
and AI
improving.
is here.
Yeah, so wow. If you are because one of the things that I thought of if I get into that is superficial ra kaayo ko. And that is something I want to to heal from myself because listening to you, I'm actually parang I'm convinced to be open to that, to that idea because honestly, before I met you, I was so closed. My mind was so closed on that because I wanted to preserve the natural look of Ludy and so age gracefully. But hey, it doesn't mean aging gracefully. You don't have to. You are restricted from using what we call enhancers. So, do you think how do you for people who would say na superficial ra kaayo na I mean what you're doing is not really essential to the human
Yes.
being.
Actually, now, even given the crisis that we're facing, diba? And then that's something you're still
last thing that you would-
that should be the last thing that you're thinking about, especially with all the calamities that we've been facing. But you cannot stop a person from wanting to feel better about themselves. And then, for example, if I want to do something that I feel like would make me look good, or I feel like when I look in the mirror, something that makes me feel good,
Happy.
I don't think I'm doing it for the one looking at me. I'm doing this for me. But every time when I look in the mirror,
True.
that it's something. Oh, I look good at this age. Oh, I look good. Like, for example, when my friend, a very good friend of mine who's a photographer, did my Mother's Day shoot. So I looked very good in the photo. Then I posted it on social media to promote her also. And then it's good hearing about people's feedback that I don't look like a mother of 4.
True.
And I look good for 36. So it's not something I brag about, but I'm proud I don't look like somebody who has 4 kids.
True, true.
I'm proud that I have 4 kids. If I could have more, I would
Yes,
want more.
yes.
Diba? Why not?
Yes.
But I couldn't naman. So, I'm happy when I meet somebody for the first time and then, you have 4 kids? You're 36?
And it boosts your I think
your
it
confidence
boosts
ba?
your confidence.
And how
It's-
you present yourself also.
And then once your confidence is boosted, I tell you, you can, it's like, it's a superpower
Yeah.
that you can do more.
Ah.
So, I'd like to invite my friends, let's not cage people or be judgmental about people who are really trying to improve on themselves.
Yeah.
I think this is, I'm so sorry, but I think this will hit a lot. I think one of the reasons why they frowned upon it, probably because they know that it's not open to all or not affordable by all. And subconsciously, they have that kind of parang I'm against it because in the first place,
I can't afford it.
I cannot afford it.
Maybe, but
So-
I would say the crab mentality. So
Yeah. So, hello friends, if you happen to reflect on yourself, why you are feeling that way, why you have that kind of resentment, please, maybe it has something to do with that. Because moving forward, after hearing from you, Dr. Geona, and now I'm getting more open-minded to it. If I can, why not? No, it's just that I'll probably take it one step at a
Yes.
time. Like get into something that's non-invasive or minimal,
Yeah.
invasion. And I'll take it from there. And, if I feel good about it and I feel fine about it, and there's something more that I can do, then why not, no?
Yeah.
I think, because I know of a number of friends, they would try to, every time they see these lines on my forehead, they're like, Ludy, I got few friends nalaga na they wanted me to introduce their doctor. Because they're telling me it's so easy, that's very easy to Oo, sus grabe, dali ra kay na siya i-fix, Lods, and you will look much
Yeah.
better. Gyud ko, really? Okay, sige, maybe later on. I'm not saying naman na to, na never, but it's just that maybe we'll see. But not until now, after hearing you, because what I learned, my takeaway now is that education, the right information is very important
Yes.
for you to make that informed decision.
Yeah.
It's not just about the tabloids that you've read. I mean, the post na kanang mga naunsa na ilang bills. Scary
Yeah.
kaayo. Grabe po di sila.
But you can actually appreciate, like, for example, when you're looking at, Hollywood stars who did procedures, like silang J-Lo.
Oo.
Well, you look up to them. They're almost 60 and then they look good. Of course, with the right lifestyle. But of course, not without injectables.
Yeah. And then, tanawan ng uban. When they see that, naanasan na yung mga bashers nga maingon, quarter, thank you, doctor. Kanaday nga line, thank you,
Yeah.
doctor. O, diba?
So there's a lot of misconceptions in the aesthetic industry. So it's nice to do like a proper consultation to have those doubts ba discussed, and then you can freely ask your questions.
So, are your patients mostly, I mean, can you give me a percentage? Like, how many of them are mothers already?
There's a lot, but
Like 80%, 50%?
in terms of the women, siguro mga 70% siguro.
So, there are more,
More in the my age. So mga middle age. So
Really?
mga
and they're getting,
early
na,
30s. Yeah, early 30s up.
Really? Wow. Not the 50s?
We do have the 50s,
But smaller percentage? Hala, tingig
Yes.
ako raya. Do, kung magpa-consult ko ni matig ako
siguro
raya, 50s.
let's say for example, out of all my female patients, the 70% would belong to the kana mid 30s up.
Uh-huh.
And then siguro 30% out of that 70% is the 50s up. Kaya I feel like it's, the saying, it's harder to teach an old dog new tricks.
Maybe they're close-minded.
They're a bit more conservative. But once they are a bit more open to it, kaya mo naman dahil nga kanang, okay na ko, tigulang naman ko.
Oh, that's surprising because I really thought ang mga oldies like me are the eager ones. But it makes sense when you said
Tigulang naman ko. Wala na may mutanaw na ko, ana.
Oh, wow.
That
Hala,
is
I
not-
don't
That is not
feel old,
something.
manggod.
That is not the way you think. For me, nga ka na, wala na may mutanaw na ako. Di ba, Mark? Anak ba?
I never had that, I don't know. Kay ako, I'm different. I don't think of that way na wala may tanaw na ako. Probably because I'm
You're
doing my
always,
inner journey
yeah.
na,
Na viewers.
No, what I mean, I'm doing my inner journey that I try not to get my validation from outside. So it's really like doing parang inner journey, looking into myself, and the validation comes within myself. Braging ana tingaling ako. I don't have those kinds of kanang thought, no. But what I'm saying is, I think I also feel young. I don't feel I think I just feel young. I'm 54, but I don't really feel very old, no? Nga moingon I could no longer do that. I also don't give much limitations to myself. And as a background, when I started my inner journey during the pandemic, I did a lot of things, as in a lot of things. First time. So I've said this before, and I will say this again. Nga my in my lifetime, probably the experiences that I had from age 0 to 50th or 48, 49th, no? You can imagine nga tingig daghan na kaayo, no? But I would say the more meaningful, or more adventurous kind of life that I have, or more active, took place, they are taking place between 48, 49 when I started my inner journey until now, wherein I explore into a lot of things. And just to mention a few, okay, I just had you today. Like I went into scuba diving for someone who doesn't know how to swim. So I'm a scuba diver. I went into golf for someone who finds it very boring. Kaya I'm an extrovert. I went into kanang gun shooting, even if I used to fear gun. I mean, I grew up with a kanang trauma and more. So na mas grabe ang nanghitabo sa ako na during my inner kanang journey. And probably it's also the same with how I look at myself. And
I think more of the shift in the mindset. Because it's somewhat similar to me. Maybe there was a certain time in my life where there was a sudden shift of people around me.
Oh.
So the mindset was very different before. I was very close-minded. I was very not open to new found friendships. I was very closed on a certain group, and then there was a shift. So I was thinking, maybe I should be more open to, not just limit myself into knowing these types of people. And then I ended up enjoying the company of different
diba?
Circles. And now I have a wider network. Or
So you are you call yourself kuan?
Introvert.
Introvert or extrovert?
Introvert. So
Introvert?
yes, I have very few friends that I call like my friend. Friend. And they were limited to like close family links lang ba. So when I opened myself up beyond the family, because my friendships outside of the family, like beyond the cousins, were more like lingering friendships lang ba. Not so meaningful. Then there was a challenging point in my life. Then I realized, these people who I didn't pay attention to so much were offering me this type of friendship, di ay? And I wasn't open to accepting. So murag, murag makig-friends na lang ko sa lain. Makaila ko sa ta. Murag anak bitaw nga murag, it took me a while to open up to them, and then kato murag na open. Kaila ko.
It's okay.
And then nga na. So newfound friendships, and they're more meaningful, and then I appreciated them so much. Moto.
It doesn't mean na your long-time friends are actually the friends till the end. Along the way, we journey to meet new friends.
Yeah, and then I was so thankful that it happened earlier in my life. My husband, kay diba, ano man siya kanang murag, di ba siya, how would I say this? Different siya maghuna-huna. So he said, all the challenges or difficult things in your life that happens, it's good, we are blessed. Kay it happened early, not late. Early meaning we are at the start of our lives. Our kids are still small. They won't understand so much. So murag, by the time they know, bag-o na tanan. And everything's better na ba?
Wow. You are still so blessed. Yeah. Ako, I said it again. I said this before, and I'll say it again. Na I'm so blessed that I'm in this space of awareness. And I started, although moingon sila quite late akong inner journey, I was already on my late 40s, but I'm still deeply grateful.
Yeah,
That's
kaya
why,
you open up more, diba?
yeah.
And then you are more open-minded. Kaya before, like, di ko maging friend, ani, kay I was so close to,
Katulang inner
ing
circle.
ana lang dapat ang categorically speaking akong pwede ma-friend. Kay the mindset was always, kanang, when we would gather, murag always lang kanang manaway bitaw. That type of mindset, murag kag sour graping, bitter towards everyone. But I thought that was my circle bitaw. And then now, which is nice, kaya na ako yung newfound friends, mas open. And even if they're doing much better than me, dili man ko bitter. Di ka masuya or anything. Which is so much better than before. Na I thought I had this circle. But always ka nang, puro ka masuya. Ano ba?
Oh, there's parang, the silent competition.
Yeah, ing ana.
Oo. Nga
And then,
pa kuhanan.
I didn't know I thought they were just like that with everybody else. Not with me. So, maraging ana pa. So, now, with the newfound, they're so much more than me, ana. But you're essential, more kag, happy
You're
for
not,
them.
Yeah. And you're not undervalued. You're not
Yeah, you don't feel
looked
bad that
down
you're not
upon.
as
Oo.
well off as them. But you're happy nga witnessing their kanang growth.
How they prosper,
Yeah,
how they
then when you
flourish.
change your mind about that, or there's something about it that you find peaceful, na okay, di ay, yan na. You don't have to
Yeah.
comment on everything. Na, anong anak man na siya? So, siya no, kanang, nalagi siya, pero yung, like this, like that. Nakay ka ng, murag
Ay,
ma-S ka ba?
no?
Murag na ay hint of jealousy always, or masuya bitaw ka. Not suya, but you have this mindset of, nadyo ka ika-comment every success in that person's life. But now, with my newfound friends, they're all successful in their own way. Dili man, wala man ko ingana na. So that's something I'm so grateful I got rid of.
Nice. That's
And then,
mother.
for my kids,
They're better off with
they're
those
better
kind
off
of,
not growing up
Oo.
with them around. And then it's so nice. And ako nga, may ragyod 4 akong kids. Kaya they can have their own
They
form
form
their own community.
barkadas,
And
oo.
apparently, my circle of friends now have a lot of kids also. Have you noticed the trend now? Tagdaghan na ang kids.
Oo
Like,
ba?
my barkada has 4 kids. One of my friends has 3 kids. Dili na ka ng usa, duha.
Oo.
At least minimum 3. 3 and up. So I was like, ay, salamat. I have friends who have lots of kids and they can grow up together. I don't have to worry about them having built-in friends
Oh.
that I should be providing through family.
That's-
I have one friend who has 5 kids. Oh my gosh. Di na ako mag-uulan ng kanang walay mga cousins or walay mga close relatives and everything like that. Because my friends
Barkada
alone
lang,
have...
Yeah.
Murag-
Tita-tito na ba ang tawag karon?
Yan, mga ninong-ninang nila, there's a lot. And they have all these kids. And then probably now, they have built in at least 20 kids nga friends. Murag, ug mag-abot mi, magkagubot na mi. So murag, I don't feel bad that they're growing up with the lack of certain group of friends ba.
I'm happy for you.
Murag, ana.
Pero Doc, if I were to ask you, being a aesthetic doctor, if you have to turn back the time, would you still be
An aesthetic doctor?
Yes.
Well, now I really enjoy what I do.
And why is that? Because enjoyment is I don't think we just enjoy as in enjoy. For me, there's a deeper reason behind
yeah.
why we enjoy. So why are you enjoying?
Diba you always hear about doctors not having time for their family. So, ano man kanang with aesthetics, well, in general, with aesthetics, I don't have to go to the hospital.
Oh, yeah.
I can decide on my own time.
Yes.
And it so happens I have a lot of kids. I need to be there for them at any point in their day or lives ba. So I'm grateful for that aspect. At the same time, there's less stress because you're not dealing with sick patients.
Yes. And you're a doctor. You have the title.
One is you're a doctor.
You have the title.
You're a doctor. There's a lot of funny reels nga kanang you're not a real doctor kay you're only so happen I have this license man, so either way I'm a doctor.
Yeah.
But the most of the patients are happy patients. Positive patients. They don't come in bearing, sad news. So they are patients who are wanting to improve on themselves. And you go on a journey with them to improvement.
I love that.
So from looking
journey with them.
this way to seeing how they're improving as weeks go by, as months, and then believe it or not, 90% of my patients are returning patients. Only 10%. That's why we always talk to the marketing ba. Do you really need boosting? Okay, from the 90% of my patients who are already loyal patients who are returning at a certain amount of time, I think I'm good. Financially, I'm okay man. I can support my kids. But if we want more, that's the only time we need to do heavy marketing. So my husband would always ask me, how much more do you want? Kanang to be frank ba? Okay, if you want more, that means less time with the kids. Okay, you're busy man.
Wow.
So if this is okay with you, this is the trend that we're gonna plan. May among
Hinduta sa inyong partnership, no?
realization ba? Okay, you don't wanna overwork and miss out on the kids, diba?
Ako, kuyawan po ko do, kay if I go to you and have that, tingalig, next akong visit, tinakagailan ako.
Not necessarily.
Ala ka, serious ni Do. Ala ba, uy, ikaw pa na magmaayos si Ludy?
Kana.
Di na ako kailan ni Ludy. Ikaw din si Ludy.
Dili na ilhan sa Face ID sa iPhone.
Grabe. No.
Yeah.
Paano yan ang story?
There are some like that.
Mo ba kalingaw, no? So,
Mga Face ID dili na i-identify.
So, okay, going back to my self-reflection on that. Again, I mentioned to you already nga, I'm getting open-minded about it. I think, ang ako yung pinaka-main concern is it safe for me? Is it something that you can guarantee to your patients?
Yes,
na it's really
in terms of procedure, product-wise, we only use FDA-approved products, right? So, approved by the Philippine FDA at the same time, international FDA. So, even before it arrives in the Philippines, it has been studied for several years. Like your Botox has been at least around for the past 30 years.
Wow. So,
product-wise, it's safe. Now, in terms of the safety, in terms of the procedure, of course, there are side effects. Side effects because it's a minimally invasive procedure, meaning it involves injections. Once you involve needles, now there are swelling, bruising, there's trauma man. So, you have to understand that it's not like you come in and then the next day, nanay in effect.
But minimal siya.
Minimal siya. But understanding that, for example, the most dreaded complication in terms of Botox is getting the ptosis, kanang ana. So you hit part of the muscle that opens up the eye, so you end up with a.
You did that also? You tried it?
I haven't encountered that. That's a very rare complication for Botox, and there's a lot of factors that come into play. One is not knowing the anatomy or injecting too deep. Another is your dilution mixture of the Botox. When you're not mixing it properly, you're probably diluting it too much and too much of a dose. So, or having activities after the Botox that's not recommended. Meaning, it was injected properly, but then, because you did something, ni-spread ang Botox to the other muscle. But that's very rare.
Okay.
So, probably 1%. So, in my 8 years, wala pa man sad buyag-buyag.
Okay.
And then, the good thing about Botox is that it's temporary. Should it happen, 6 months is the longest that it will last. It's reversible.
Okay. So, hello, friends.
That's only for Botox.
Botox is not bad at all. I mean, it's just now I know na ano pala. There's a lot of things going on. It's not just one procedure true to all.
Yes.
So it's customized, and there's, there are precautions. There are
Yes.
things that you need to be aware of, not to do, what to do.
Yes.
So
Post-procedure
so in other
instructions
words,
matters.
you should find a good injector, find a good
Yes.
doctor, and make sure that the products are legit. The
Legitimate,
products,
yeah.
and approved by
The FDA.
FDA.
Yes.
Okay. So these are the few things that we should remember when we go to and to make sure that you have all those, go to A+.
A Plus Clinic, Premier Aesthetics.
And then how many branches do we have, Doc?
We have a second branch in Lapu-Lapu, but it's under Alpha Premier.
In Lapu-Lapu. I'm from
Yeah.
Lapu-Lapu.
In
Where?
City Times Square.
I'm really
In Basak. But
Of course,
for
I
the
go there.
non-invasive ones, I focus it more on my side.
So who's manning
Si
that?
Charles, my husband.
I'll visit him.
Yeah.
Actually, tomorrow I'll be there. Oo. Actually, I came from City Times Square. Anyway. Really?
Yeah.
So that's...
So we used to have one in the south also. That's where we started in 2018. So we've been in this industry for the past 8 years already.
Wow.
And during that time when we started, it wasn't really a trend. Everybody was afraid doing Botox, getting the fillers, getting threads. But now it's more acceptable, more accepted.
More widespread and more acceptable, because probably also the reason behind it, Doc, is more and more people are getting well informed,
Yes, and then
that-
I think more of the social media influence
and the
also.
social media
Because
has
there's
also
a lot
helped.
of, not in terms of the marketing, but because you want to be present in the social media scene to improve on your business, to promote your business, or to promote something.
Journeyscapes with Ludy
Yeah.
will be different in the coming.
So when you are promoting yourself, you have to look good, you have to be dressed well. So
Yeah.
that comes in at a package man. So muna.
Do you also do you get conscious about yourself being a parang the walking advertisement or the model
Yes.
of your
I do. That's why when I had the fourth baby, I was so big. That was the heaviest. Yeah, the heaviest I was at was 65 kilos. I wasn't necessarily that fat, but I was fat for my frame, but ako. And I wasn't looking good in all my clothes. So I decided last year to go into weight loss journey and focus more on my health, because I wasn't feeling as confident. Although I had good skin always. But that's something superficial or good. You don't want to be always in your scrubs na lang. So I wanted to be, because I gave birth again for the past, since 2020, diba? So most doctors ended up just wearing scrubs na lang since the pandemic, because it was easier to wash, easier to maintain. That's why karon you can see a lot of doctors walking around with just scrubs, because garter, not so hard to iron, low maintenance. So, very flattering pag yun in terms of the frame. So, everybody's just wearing scrubs, not noticing that their actual non-stretch pants are not fitting anymore. So, when I realized I was really heavy na, I decided to lose some of the weight. Because I wanted to look good, not just for the patients, but of course, it helps one good when you look good. You can
they will
market it
yes.
more. Okay, for example,
We check on the doctors.
yes. How would you sell something? Like, for example, how would I sell something that's for weight loss, or how would I promote something for weight loss if I myself am
You're
not
not
in shape?
Yeah. True.
diba? And my number one rule in the clinic is any service that I offer in the clinic, I should be trying on myself first before
So
I
you
put
tried
it out.
all the services that you're offering.
Yes. For example, this injectable is too painful. Even if that's the trend, I don't I would empathize on the side of the patient that's gonna get the treatment. And I would choose a less painful treatment. Not unless grabe gid ka significant ang results, and I would say, then this is just the only solution for you. But if it gives you the same results with a less painful option, I would choose the more comfortable one.
Wow.
But how would I know that if I didn't try it,
Yes.
diba?
You're really
And
a
how
good
would I
doctor.
know if it's
Yes.
safe if I myself didn't try it?
It makes sense. You're really a good doctor. So, if I were to ask you also, as a mother, how do you feel about being a mother? Is it something that any doubts about being a mother?
A mother? I like being a mother. I didn't expect to be a mother of 4. I would have expected to have just 2 kids. Okay, before I got married, samukan man ko mga bata. Like, kanang, samukan ko. And I used to ask my mom, Mami, unsa man na ang feeling kanang ikaw ang mommy, no? And then your baby is not so cute. Dili kay siya cute, good. Kay, let's say, dili cute ba? Ikaw as a mother, do you find the baby cute? When you know for a fact na dili cute ang baby? Wala siya nga, cute gihapon na in your eyes because as a mother, ikaw man, you love the baby first man daw. Kung aana din na ang motherhood. That was, I couldn't forget this because we were waiting for my dad to drive around sa SM nga parking lot. And ay baby lagi. Na dito. And I didn't find it cute. So, I was asking my mom, Mami, if ikaw, imong mami, kanaan na, ikaw ang mami niya, baby, ikaw as a mother, do you find the baby cute? Siya, yeah, you will still find it cute. Asa man din na muliwat sa imuha man na. Kigikan man na nimo. Bitaw sa no. And then you, let's say, liwat sa imong bana. O, na in love man kasi imong bana. So, that is still something you made on your own. You, murag, unsa na ilang giingon? Only a mother could love. Ano ba? So, as a mother, ako, I enjoy it. But I dread it sometimes when it's very overwhelming to have.
Understandable.
No? Kay kanang gubot kaayo and they all want you at the same time. Ano ba? But it's so nice to have 4 kids and have many kids.
Yes, that's right.
And we're so excited. Like now, we're into pickleball and then we see a lot of younger, mga 18, 15, playing pickleball.
So you are now imagining
the
when
kids
they grow
growing up.
Yes.
My husband last week was playing with 12-year-olds and 13-years-old boys. I was like, no, ang mga kids, may nga na de. Kaduwa na din nato ang kids, inigdako na sila. Mura nagbarkada. Ayun, nag-compute nga. Ako 36 ko karon, 13 sa ako anak, 40. Makadagan pa. 50. Makadagan pa siguro ko anak. So we were because again, we had the kids a little bit later compared to the others, diba? So murag, by the time they're in their teens, 50s na me. So murag makadagan pa siguro ko. So now we are in our mid-30s. We do want to bank on the kanang health ba. So we're going into more fitness. We're trying to do more. My husband is more specific weightlifting, calisthenics. We're doing pickleball for cardio. To para maka-apas patas sa tong kids by the time they're in their teens. Not just now, they're young. And we want to be able to be there for them after their college na. Kaya we were computing, 13 na nag-start. What if one of our kids want to become doctors? 30 na mahuman because of the K-12. So 30 na. Inshallah, 60. So di pa dito mo retire any by 60 because we will have to sustain them. Okay. Being a medical student, gasto baya siya.
So you are trying to project that your children are going to follow your steps? Do you have...
Not necessarily as much as I want. As I don't want them to become doctors. I do want them to go into other fields. But
that's interesting.
Imuhang i-budget, kumbaga. If in case one of them decides to become a doctor, that would take them 30 years from now.
Yeah, but personally, you mentioned that, you don't, as much as possible, you don't want them to, you want them to take other courses.
Yeah, other courses.
Oh, why is that?
So they can start their lives earlier.
Ah.
Okay, going into medicine, you will have to extend your
Okay.
life for another 6 years.
Wow. Well, that's
And it's not an assurance that you do well in life.
wow.
Di ba?
Okay. But for me, I'll let my children take their journey too.
Yeah.
So I'm already in that space na
But if
dili na
they...
ko mag-consumption.
Yeah.
Yeah, I can share with them pieces of advice, but I'm already, you know, having teens before. It really taught me na it's a they are a new generation. So what I learned before could no longer be
Applied.
applied
It's very
to
different,
these
ano?
really
Mo
different.
lang, we
Oo.
always say nga, if one should decide, let's say the youngest one should decide to become a doctor, that's 30 years from now, we should be able to sustain them up until the end of their...
But sayang po kung walay mo sunod, di ba? I mean, you
Yes.
have already established, you have already founded these
Yes. My husband,
businesses.
Manggod, he sent himself through med school, through a business. So he ran his own business before. That's a very hard thing to do. So we don't want the kids to have challenges in terms of their finances. So
Okay.
we want to be able to be there for them should they require financial support. Bitaw.
Okay.
So that means I'm 36 now. 28 years after, kaya mag-2 naman akong second, ay akong youngest. So 60-something na ko. I should still be able to put food on the table. Kaya wa po man na siya ikapang tuition.
Oo. True.
But if, for example, by, let's say, 20 years from now, my eldest is graduate na from college and she can have her own career. That's a bit earlier. I'm still 56.
Yeah. So 2
Able
years.
pa ta to sustain.
Yes. True.
That is something. But, of course, we want to prepare for that. We don't want to be kanang late in the kanang planning stage. It's just us more forward thinking ba. Nga, dapat by the time we're 60s, able to function pa ta. So that's why now we're, if you notice, our mindset now is different. Siguro from our peers. We're more of child rearing in terms of focusing more on how they're brought up. At the same time, planning ahead.
So if you rate 1 to 10, how happy are you as a mother?
10, I guess.
10,
in
wow.
most days.
Okay. So maybe 9 because you said in most days. So
In most
not
days.
really perfect 10.
Yes, I guess nobody can say that. Nga, perfect jud. But I am truly proud to be a mom.
Me
and
too.
be able to balance my career and the business at the same time.
Wow. Dr. Joanna, I love the conversations that we are having
Yeah.
because, again, I love talking about motherhood and I'm curious of what you do. And I'm so grateful that you share this space with me on motherhood and self-care. But very kuan kay siya, no? I never thought of getting into this kind of topic of medical aesthetics because in the past years, I was so focused on self-care the natural way, you know. If you knew me before, so it's always there, the natural way. I'd love to do it the natural way. But you have opened up my mind on, you know, it doesn't make you a shallow person. If you are going to be open about aesthetic beauty, it doesn't make you a shallow person. It's basically trying to make use of what is out there because I do believe that it's part of the creation of God. There's a lot of debates on that. That is no longer God's given. But hey, the skills, the talents that we have, I don't think we should throw that away. I think we should be able to make use of it. And if you have that, then let's do it for a good purpose.
Yeah.
And I believe what you're doing is really, I really love when you said your journey is like journeying with your patients from this emotional state to this emotional state of how they look at themselves, of becoming really better, evolving into a more beautiful version of them. But then, we have to end this
Yes,
episode, and I'd like to have you again in our future
Yeah,
episodes
sure.
to continue on what we are having here, this very interesting conversation. But before we go, I'd like to say thank you to
You're
our
welcome. Thank
partners and
you.
our sponsors. Of course, Bagong Pilipinas, Visayas Studios, A Plus Clinic Premium Aesthetics in Astra Center, TFM Head Spa, the pioneer in Korean Head Spa, David's Salon, Central Block, Ayala, Aura Beauty Studio at the Pad, Smile Syndicate Dental Clinic, Mactan, V&M Skincare Naturals, Dahlia Chocolates, Phuket Kitchen in El Dorado, Banilad, Atelier Amelie Premium Brownies, Fat Shaolin, Frozen Dumplings, Dubby's Ultimate Burger, Iya by the Wada Yoga Studio, Shan's Collection, Migo Expedition of Safari Adventures, and United Neon Advertising. And here's a beautiful macarons and chocolates box for you from Dahlia
Thank
Chocolates
you.
Doc.
Thank you.
Oh, so favorite po kaayo nako na.
My daughter
Okay.
loves macarons
So,
also.
before we go, is there any like final piece of advice to our friends who are listening, watching us?
I guess my advice would be to really, know what you want to look like, not superficially, in terms of how you want to feel, how you should be, you should look the way you feel inside. Murag,
Not dictated by
not dictated by the other. So you can, if you this is pretty for you, not just
know you what you
physical.
want.
Know what you want, and then nobody should be able to dictate otherwise. Okay, that's your face. That's how
Yeah.
you should be
Own it.
feeling. Yeah, own it. Don't feel repressed by the societal demands of you. Okay, again, that's what I learned over the years. Though I'm not that old, I'm still generally young. But my piece of advice for everybody: if it makes you feel good, then do it. Because when you feel good, you do better. And you
Wow.
do better, you help others.
you can help more.
You can help more,
people.
advance the lives of other people
Yeah.
around you, and be more of a contribution to society.
Wow. Thank you very much, Doc. Dr. Geona Ann Macrohon.
Yeah.
Oo, Geona. But that it spells
Geona.
G-O-N-A. G-O-N-A. And as for me, I have a lot of takeaways today's episode with Dr. Geona, and she literally opened up my mind. Literally pa. Oo, she opened up my mind into, embracing what is out there to help us enhance, to make us feel better because we look better. And one more thing, just a gentle reminder, as mothers, please do away from overgiving. Before you can give away love, make sure that you look into yourself and have enough self-love, because it's only upon having much self-love can you share more. Okay, you have to fill in your cup and let it overflow, so that the love that you share with others is the genuine kind of love which does not drain you at all. And it's very important, because as mothers, we are looked up as models, we are looked up as their idols, and even my children would call me iconic. Hey, thank you, adorable, so for that. And so thank you once again to our friends who have been with us, and thank you, Dr. Geona Ann Macrohon, and I'd love to have you again in
Thank
our
you.
Journeyscapes with Ludy. Stay tuned for the next episode, and at this point, we'd like to say goodbye.
Bye.